Scrotal dermatitis. Dermatitis refers to chronic inflammation of the skin. The scrotum skin is very thin, making it easily irritated and inflamed. Exposure to allergens and irritants, especially on a regular basis, can cause scrotal dermatitis. Itching, scratching, and chafing of inflamed skin can irritate the small blood vessels close to the skin surface. This can lead to bruising or the appearance of other dark spots. While a person can have an allergic reaction to almost anything, some chemicals and compounds are more likely to cause dermatitis. Common causes of external genital dermatitis include clothing dyes, chemicals in laundry detergents, spermicides and lubricants, topical antiseptics and antibiotics, chafing from underwear or protective sports gear. Less common causes. Very rarely, black spots on the scrotum can indicate a severe medical condition, such as HIV or skin cancer. Diagnosis. A doctor will perform a variety of tests to determine the cause of spots on the scrotum. They may be able to make a diagnosis based on a physical examination alone, but more complicated tests may be required. A doctor might also refer a person to a dermatologist, who specializes in skin conditions. This will depend on a person's symptoms and other factors specific to an individual. Tests often used to diagnose black spots on the scrotum include a complete blood count, tests for liver and kidney function, screenings for STIs, such as HIV and hepatitis B and C, an erythrocyte sedimentation rate test, which can indicate the extent of inflammation, a biopsy, which involves taking a sample of skin to study, an ultrasound of the lower abdomen and genital area. Treatment. Depending on the cause, a range of procedures, medications and home remedies can reduce or eliminate black spots on the scrotum. Bruises. Most bruises respond well when a person applies an ice pack or mild heat to the area. Some over-the-counter creams may also ease pain and inflammation. Dark or ingrown hair follicles. There is no medical need to treat dark hair follicles, though some may choose to lighten them for cosmetic purposes. Ingrown hairs can usually be eliminated by exfoliating. This will remove the top layer of dead skin cells and help to prevent hairs from becoming trapped. Pimples or blackheads. The best way to treat most pimples and blackheads is to keep the area exfoliated, clean, and dry. Larger pimples and blackheads may respond well to a warm compress. This will gently encourage blood flow in the area, which can help the bump to burst and resolve. Hyperpigmentation. In most cases, there is no need to treat areas of hyperpigmentation. A person may choose to have prominent lesions, such as large or irregular moles, surgically removed, especially if they are causing discomfort. See a doctor if a mole has irregular borders or grows rapidly, as this can indicate cancer. Angiochrotoma. Because they are usually harmless, there is usually no need to treat angiochrotoma lesions. A person may have them surgically removed if the location or size causes discomfort, or for cosmetic reasons. A doctor will often take a biopsy of a lesion to ensure that it is not cancerous, particularly in cases of removal. Techniques commonly used to remove angiochrotoma lesions include laser therapy and excision or scraping, usually with a scalpel. A person may instead have their lesion frozen off or burned with an electric current. Scrotal dermatitis. The best way to treat scrotal dermatitis is to avoid exposure to the allergen or irritant causing the inflammation. To reduce symptoms, wash the skin gently with mild soap and lukewarm water several times a day. Taking a long bath with Epsom salts or oatmeal may also help. If the dermatitis is severe or lasting, a doctor may prescribe a steroid cream to reduce itching. Genitals. The treatment of this STI usually depends on the size, extent, and location of lesions, as well as the amount of concern a person may have. Over-the-counter wart treatments are not safe to use on genital warts. While there is currently no cure for genital warts, a person may choose to have them removed. Common methods of removing genital warts include freezing them off, burning them with a cauterizing device, cutting or scraping them away with a scalpel, applying prescription creams and chemical preparations designed to separate warts from the skin. Removal usually reduces symptoms and can lower the risk of infecting a sexual partner. The Gardasil vaccine can provide immunity against two types of HPV virus that together cause around 90% of cases of genital warts in the U.S. When to see a doctor. Talk to a doctor or nurse if black spots on the scrotum are causing concern, pain, or discomfort. Also, Seek advice if these spots are changing for cancer for no apparent reason. For most common causes of these black spots, simple treatments can reduce or eliminate symptoms. While black spots on the scrotum very rarely indicate cancer or HIV, a medical professional should rule out any possible link to a severe condition whenever a black skin lesion appears on the body. Outlook: in most cases, black spots on the scrotum are harmless, and any associated discomfort will be mild. See a doctor if these spots change, have an unclear cause, or lead to long-term pain or discomfort. Treatments and home remedies. Whiteheads caused by acne do not usually cause other symptoms or pose a health risk, and so medical treatments are not required. A person can treat or prevent whiteheads on the penis using the following methods. Avoid touching the area to stop whiteheads from spreading. Wash the area regularly to stop bacteria and oil from building up. Avoid picking or popping whiteheads, as this can cause irritation and scarring. Use over-the-counter (OTC) medication that reduce bacteria and excess oil. Some OTC acne medications contain chemicals such as benzoyl peroxide, salicylic acid, or exfoliants. The skin of the penis is very sensitive, so anyone who notices irritation should stop using the treatment. Home remedies that could help reduce the spread of whiteheads include tea tree oil. Tea tree oil has anti-inflammatory and antimicrobial properties, which can help to reduce whiteheads. Witch hazel. Witch hazel is a plant extract that is an ingredient in many OTC acne medications. It may act as a cleanser to clean out pores and reduce whiteheads. Some home remedies, such as apple cider vinegar and lemon juice, are too acidic for sensitive skin and people should not use them on the penis. When to see a doctor. If a person has bumps on their penis that get worse or do not go away by themselves, they should consult a doctor, as the bumps could be a sign of a more serious condition. This is particularly important when the person is sexually active. If the bumps are itchy, painful, or occur with other symptoms, a person should seek medical attention as soon as possible. Until a doctor can confirm the cause of the bumps, a person should avoid sexual activity to reduce the chances of spreading an infection.